During this webinar, you will be hearing from Dr. Matt Burrell, Chair of Pediatrics here at Southwest College of Naturopathic Medicine. Dr. Burrell has been a Defeat Autism Now practitioner for 7 years and has trained with some of the most respected autism doctors in the world. He has published the 3 latest research studies on the correlation between heavy metal toxicity and autism. Dr. Burrell is also the founding and current president of the Pediatric Association of Naturopathic Physicians. So once again, I thank you for attending our webinar. We hope you find this presentation both interesting and informative. And with that, let me introduce our presenter, Dr. Matt Burrell.
Hi, thanks, Jody. Can you hear me okay? Okay, let's see. All right. Okay, so hopefully you can see my screen and you can hear me okay. I'm Dr. Matthew Burrell, and Jody had given me a pretty full introduction here, and what I'm going to talk about a little bit today is about some of my own research and what are the kind of the pediatric activities that go on here at SCNM. I've been here now for 12 years. Got here in November, actually almost 12 years, November of 2001. And in those 11 years, 12 years of being at SCNM, we've done some really impressive expansion of pediatric medicine here, not only within SCNM but also within the profession of naturopathic medicine. So as Jody had said, I'm also the president of the Pediatric Association of Naturopathic Physicians, and I'll talk a little bit more about that. And it is a specialty organization within our profession, and my interest in pediatrics really came out of several reasons. One would be that I think that wellness and preventative medicine is really mostly done, I think, most effectively in the pediatric time frame. You know, when a child's an infant, certainly breastfeeding and certain things that we can do very early on are going to have lifelong changes. So that was my interest in how my interest in pediatrics grew. And there was also not much of a pediatric movement about a decade ago within our profession. What we have here at SCNM there's several opportunities for students and patients to get some exposure to naturopathic medicine in the world of pediatrics in particular. So we have the didactic portion, which is just the classroom portion. You know, the naturopathic medical program is a 4-year medical program, post-baccalaureate, and so the students should have already had some experience with organic chemistry and in some cases physics and general biochemistry and certain areas that would prepare them for a much higher level of basic science education, as well as clinical education within the classroom, which is the didactic portion of our program. We have Pediatrics 1 and 2, and those are the 2 different quarters of pediatrics. The one is the more basic pediatric medicine discussion, and then Pediatrics 2 will be more of an advanced kind of class and discussing more complex treatments and diagnoses and cases. And in the classroom part of the pediatric part of our program, it's really a combination of both naturopathic principles and conventional medical principles, because we do know that so much information has been gathered and accumulated from the conventional approach to pediatric medicine, which we certainly utilize in areas of diagnosis and laboratory testing and emergency medicine, because it's fairly well established that information is clear information that has a lot of years and a lot of research behind it. So we like to pull into, as far as the pediatric faculty here at SCNM, we like to pull into our didactic teaching as well as our clinical rotations, a piece from both sides, a piece from naturopathic medicine, and then some information from conventional medicine to help us come to a really clear, integrative, and whole body approach and whole person approach to treating our children in our clinic. The clinical rotations are really designed to give the naturopathic student, the naturopathic clinician, an introduction into what it's going to be like when they get out of school and they're going to be practicing on their own. So it is always important to bring in sort of conventional testing, like mentioned during the didactic part of this discussion. It's really important to talk about what is conventional diagnoses and lab testing so that we have an idea of what's going on with the patient. But as far as treatments and as far as a treatment approach and preventative medicine, we really utilize naturopathic medicine's gift at doing such a good job at preventing disease and also getting to the real root of the problem, not just sort of covering up symptoms with either fever medications when they're not necessarily necessary or anti-inflammatory medication when in fact there might be something that's actually causing that inflammation. And we try and get to the root of that during our history and our physical exam and our discussion with the parents. Our clinical rotations, as far as pediatrics goes, includes three different locations where we do specialized pediatric treatment and care. At the SCNM, at the Southwest Naturopathic Medical Center, which is the medical center for the school, we have 4 physicians who do specifically pediatrics, and those are the opportunities within the med center's clinic to do pediatrics and get that experience as a clinician, start to practice what it's like to interact both with children and as well as both with the parents, which is kind of the other half of that clinical piece. So we have 4 physicians here, myself and Dr. Mitchell. There's 2 other physicians that do primarily homeopathy with their pediatric patients. And the rotations with those doctors are very in-depth, and again, students are grilled and quizzed on why they think the patient has a specific diagnosis, or why they think they should be running certain lab tests, and why we are employing certain treatments in certain patients. So the rotations are challenging from the aspect of being a clinical student and preparing you to go out in the real world and be a physician and treat people. The Hamilton Elementary School Clinic started about 7 or 8 years ago now, and that is a free pediatric clinic on the west side of Phoenix in a very socioeconomically challenged area, and most of the people in the Hamilton Elementary School, it's somewhere between 95 to 100% are on a free meal program. So we do know that the vast majority of the students at the Hamilton Elementary School are below the poverty level or at poverty level. So these people often don't have very good access to medical care, and by having the Hamilton Elementary School Clinic there, we can provide kind of a safe haven for those who don't want to go to the emergency room or go to urgent care, where there's often long lines and they're sometimes not treated right. We kind of remove some of that burden, especially off of the local emergency rooms in that community, by doing good primary care and also preventative care with most of our patients, so that they can live a healthier life and not need as much medical care in the future. The Beach Clinic is backed by Scottsdale Healthcare, and that is where our other primary pediatric faculty practices. Again, the beach clinic serves a socioeconomically challenged community, and that's another opportunity for students to do what is called an extended site clinical rotation. And when we are treating patients at those clinics, we're treating the typical pediatric conditions, so asthma, colds and flus, eczema, different skin conditions, certain behavioral issues, digestive complaints, all of the typical things that you would see come into a conventional pediatric office. Like I talked about, I mentioned the Hamilton Elementary School Clinic. The Sojourner Center is one that I didn't mention before. That is a domestic abuse shelter, and primarily for mothers as well as the children of those mothers who are escaping domestic abuse. And we see patients in that center as well. It's another pediatric opportunity other than the three mentioned before. Now, we do quite a bit of autism care at SCNM, and I'll just expand a little bit on what our healthcare is for the autistic patients, and it's based off of some of the research that I had done with some other autism specialists, some of the most well-regarded in the country. A lot of what we base our treatments on are sort of expanded upon within this particular article that was published in the Alternative Medicine Review 2 years ago, using biomarkers and looking at what sort of deficiencies we know to be clearly related to patients with autism as well as ADHD. I published this with Dr. Bradstreet, who's one of the foremost autism specialists in the country, as well as Dr. Dan Rosenthal, who's also very well known and well published in the area of autism. Dr. Adams, James Adams, who is a professor at Arizona State University, as well as Dr. Jessica Mitchell, who I work with, and Dr. Bradstreet, who now works both in Florida and California, had decided to do some research in the past on specifically toxic metals and its relationship to autism. And what we did notice is specifically there were a few metals that were found to be in higher levels in children with autism versus children who did not have autism. And we saw that lead, mercury, aluminum, antimony, and tin were elevated in those patients. And we also see that two other studies sort of support our findings in this paper that we published in 2009. Porphyrins, as well as baby hair studies in children with autism showed some of the same toxicities. So it was encouraging to see that we had, a nice sort of reproduction of the results in this particular study that we were able to publish under the SCNM Institutional Review Board. So it was a peer-reviewed, it got published in the Journal of Toxicology, a peer-reviewed journal that was published out of Southwest College of Naturopathic Medicine, which we're very proud of, because there are really very few other studies that looked at this particular issue. We also published two other studies out of that same data, both in BMC Clinical Pharmacology, and the first was the efficacy of a chelator, or a heavy metal treatment called DMSA. We published in two separate papers, one the medical results and the other the behavioral results. And what we found with the medical results is that we found that platelets, which is something involved with clotting basically in the blood, we see that those numbers normalized. We notice that a lot of children with autism actually have elevated platelets, which indicates that there's some kind of inflammation going on somewhere in the body, and it's not always clear as to what that's coming from. We also saw that glutathione levels, which is our own endogenous substance that we use to essentially detoxify from the environment. We noticed that when we used this chelation therapy, this DMSA, we noticed that glutathione levels would normalize in the patients with autism. And for our behavioral results, we saw that our testing, our behavioral testing, those particular results all improved. So the pervasive developmental disorder behavioral inventory, the severity of autism scale, the ADOS, other parental tests all showed improvement under the treatment with oral DMSA, and there were no major adverse effects, there were no major toxicity. So we were excited about the results because I think that chelation is a very sort of controversial treatment and topic because there had been adverse effects reported in the past by physicians who were incorrectly using not oral DMSA but other chelators that aren't supposed to be used in children with autism. And unfortunately, chelation and heavy metal toxicity gets put all into one basket. But we were able to show here that it's an extremely safe and also effective therapy. And these papers were also published out of Southwest College of Naturopathic Medicine. Now, if we look at some other points about autism, we see just some interesting things to discuss. There's so many different aspects to autism. When we look at autism treatment, there's heavy metal issues like represented in the research that I just talked about. There may be some problems with vaccines. There are a few patients who have won class action lawsuits showing the vaccines were related to their autism, but they're not related to everybody's autism. There are some children who are born, obviously, with autism who have never gotten any vaccines and still develop autism. So we know in those cases, those patients haven't been affected by vaccines. So it's really very dependent on it's a very individualized basis, and that's why we do individualized testing for patients. But the next slide, I will just talk very briefly about the parasympathetic nervous system and the sympathetic nervous system, which are really our gas and our brakes. Our sympathetic nervous system is our gas. That's our get up and go, our fight or flight, and our parasympathetic nervous system is really the brakes of our nervous system. It's kind of the opposite of the sympathetic. This is our rest and digest section of the nervous system. And what we see in patients with autism is that we see that the brakes, essentially the brakes part of their nervous system is not working very well. And we don't know exactly what affects that, but we do know that some research in Japan, where we do have quite a bit of the patient population that has been mercury toxic from the amount of seafood that they eat in Japan, we have seen that exposure to methylmercury certainly affects the ability of the parasympathetic nervous system to function correctly in children with autism. And so we consider, going back to this slide, we consider in these cases certain things that will help with kind of stimulating that part of the nervous system. So consider chelation. Chelation could be certainly a viable, safe option for some children with autism if there is some mercury toxicity that they've accrued at some point in their life. Something called choline, which can be an amino acid that is utilized to help with providing the transmitters that actually attach to receptors within the parasympathetic nervous system to help calm us down. We know that galantamine is a supplement that has been documented to help also with stimulating the kind of parasympathetic part of the nervous system. And then oxytocin, which we've also seen in many research papers showing us that it can actually calm down some of the hyperactivity and the anxiety in not only children with autism, but also children who have generalized anxiety disorder as well. Other issues with autism is the autoimmune aspect. And we know that this research from 2005 showed us that there is actually inflammation in the brain of some children with autism. And when we look at some of the slides, I know this is kind of maybe a technical looking slide for most people, but these are slices of slices of brain tissue showing us that children with autism, specifically this area right here with this brown staining we see, has something called marked glial activation, which just means that there's inflammation in the brain of children with autism. This is an autistic child. This is and these two slides, A and B, are of neurotypical children. And so we want to get to a place where we can kind of decrease some of this inflammation. We also see that there are some other issues with the brain tissue in children with autism, in that there are specifically missing places where there should be cells that actually help secrete something called GABA, which is a neurotransmitter or a chemical in the brain that calms down overactivity. We see that if we don't have enough GABA in our brains, often we have seizure activity. And so by calming down some of this inflammation early on in the child's life, we could prevent some of this cell loss, this Purkinje cell loss, which helps us produce GABA. We also see that looking even closer at some of these brain slides, we see that there is this brown staining again, and it happens to be right around the vessels of some of the some parts of the brain, which is concerning to physicians. It means that there's a decreased amount of blood getting to certain parts of the brain. So if we can decrease some of that inflammation early on, we can have some good results early on in the child's life. We see that this is also represented in another study from 1999 showing that there is this these antibodies, when you compare that to children who don't have Landau-Kleffner syndrome as well as autism, they don't have that same kind of staining. And so this research really backs up what we're looking at, and this is our approach to autism care, and really other pediatric conditions that we look at. We really utilize a lot of this conventional research to get to the root of what is really the problem in a lot of our conditions. Something that we use extensively in the area of inflammation, both in autism and again other children with inflammatory disorders, is curcumin or turmeric. It's known to be, obviously just a spice in things like Indian food, but it's actually extremely effective medicinally, and there is some good research backing its use in both autism and other inflammatory disorders. We see that it binds to lead, so if there is ever a lead toxicity issue, we find that it's helpful for lead binding. We find that it's anti-inflammatory, so we can calm down some of that inflammation that I had mentioned before. We also see that it stimulates gallbladder contraction, and what's exciting about that is we have a lot of children who don't digest their food very well, especially on the autistic spectrum. So turmeric is also very helpful in that sense. And then it's also protective of the liver. In other words, the term for that is hepatoprotective, and we see that it's very protective of the liver. It calms down any kind of inflammation that's going there, which is exciting. We see other problems with autism: impaired biochemical activity called methylation and detoxification. We see that there are certain metals here. Hg stands for mercury, Pb is lead, and An is antimony. Any of these things you can actually acquire from certain environmental toxins, environmental exposure. There's certain flame retardant furniture or blankets or clothing that you can actually absorb antimony from. And from a naturopathic approach, we want to remove those things obviously from the child's life, and then we want to try and look at biochemically what's happening with the child. So you see this is kind of a complex biochemical picture, but we see that everything in red there, minus the heavy metals over there on the left, everything in red is found to be deficient in patients with autism. And so we like to think of giving things to support this particular biochemical pathway. We give folinic acid, which is the active form of folate. We give methylcobalamin, which is, or methyl B12, and trimethylglycine. Those three things seem to actually help that one enzyme that is impaired by heavy metal activity or heavy metal toxicity, and helps us get down to this bottom spot, which is glutathione, which I had mentioned before. Glutathione is very important in helping us detoxify from the environment, and we really do live in a much more toxic environment than we did, let's say, 50 years ago. So this is kind of another side approach to what we do with our children with autism, as well as children with other behavioral issues. We see that mitochondrial dysfunction is also a problem. Those are the powerhouses of our cells. We see that in 2008 there was some research that really showed us how this is quite a prevalent problem in children with autism. We can actually replace one of those amino acids that we see is deficient in patients with autism. It's called carnitine, very easy to replace and very safe. And then we see that vitamin D is also a problem in autism. We see that vitamin D's effects on astrocytes, which are part of our central nervous system. We see that it increases levels of glutathione, which is abbreviated as GSH, and decreases nitrite production, which contributes to inflammation in the brain. We also see that vitamin D supplementation in animal models actually decreases autoimmune activity, which leads to inflammation in the brain tissue, which is otherwise called encephalomyelitis. We also see that there's a pretty clear connection between vitamin D deficiency and autism. So we see that the Amish have very low autism rates, and we think that it's possible that the reason that they have lower autism rates is that they have less pollution in those areas. And that is potentially why they're making more vitamin D and why they have lower autism rates. We also see that there's some elevated levels of autism in places where you don't get a lot of exposure to the sun because of rainfall in places like California, Oregon, or Washington. We also see that the use of things like cod liver oil, which have very high levels of vitamin D, actually decrease our risk of certain autoimmune disorders like diabetes, which we know to be autoimmune. And we see that children with autoimmune disorders, if we look at it sort of backwards, we see that children with autoimmune disorders like diabetes are deficient in vitamin D. So these are just some of the areas that we really look at when we're kind of trying to use a combined naturopathic and conventional approach to treatment in just one area, in particular autism. I think a lot of people have been interested in talking about preparing for a specialty. I get that question a lot when students come to do rotations and they observe what we do on shift. They ask about how to prepare for a specialty, because not everybody who goes into naturopathic medicine really want to be doing just family practice. Some people don't want to see adults. Some people only want to see kids. Some people want to go specifically into women's medicine. And the profession, the naturopathic profession, is accommodating that, not just because the students want it, but because the physicians, after they get out in practice, they start to develop a real passion for certain parts of their medicine, and leave other parts of medicine to other practitioners who want to do that more. So if you want to do a specialty and you are a naturopathic student or you're thinking about it, you could certainly, there's a bunch of options. There's certainly rotations with specialists that you can do outside of the clinic, or you can do rotations with specialists that SCNM certainly has. And like I said, there's in particular 4 pediatric specialists within the medical center. And then you can also get involved with the specialty associations. So other NDs are doing certain specialties, and obviously we're talking about the Pediatric Association, which I had formed several years ago. And we have both student as well as professional members, and you could be a student member for very cheap and be part of a web chat that we have about challenging cases and the support from the board, if you are trying to figure out how to start a pediatric practice. We know that there's an environmental medicine association that Dr. Walter Crinian, who is on faculty here at Southwest College of Naturopathic Medicine, he has formed the Environmental Medicine Association. So if you're interested in specifically doing only environmental medicine and environmental toxicity treatment, then you would follow Dr. Crinian on his rotations, follow some of the specialists within that area in our profession, as well as be part of the Environmental Medicine Association. Recently formed is the Psychiatric Association of Naturopathic Physicians by Dr. Mark Janikula, and that is just getting off up on its feet in the past several months. And then there's the Oncology Association, which was really the first specialty organization started by Dr. Daniel Rubin, and that is a very well-known association. The Oncology Association of Naturopathic Physicians does specific specialty testing in order to gain more of an expansive both knowledge as well as recognition within the profession and in the public as a naturopathic oncologist. And then there's also women's medicine rotations that you can do, as well as women's medicine residency positions after you graduate. There are pediatric residency positions, there are environmental medicine residency positions, there are oncology residency positions, and there's women's medicine residency positions, all existing within our profession. So if you're interested in that, then you can certainly pursue it in that way. And then I think that was the last slide. So I'm open to answering any questions. Jody, if you're, are you still hear me?
Yeah, I can hear you. Just transfer the baton to me.
Okay.
Change presenter.
Let's see here.
Over to your right.
Okay.
There you go.
Are you in?
Yep, 1 second. All right. Thank you, Dr. Burrell. So at this time, we will open the floor for questions, as well as address those questions that were submitted beforehand via our website. You can always request information from me at j.durham@scnm.edu. So let's go ahead and begin the questions that you have regarding pediatrics at SCNM. Let's see, Angie asked, how does the process work to get into a residency program for naturopathic medicine?
The process is pretty simple. It's recently become quite streamlined in that what's going on is you do a matching program, and each school has a number of residency positions, and each specialty also is part of that matching program. And so when you are thinking about what you actually want to do and what kind of residency you are thinking about actually applying for, then you would start to talk to the people who are on the interview committee for that residency, or people who have done those residencies before, and that would provide you with a little bit more information on whether or not that residency fits for you, and how to apply, and how to kind of gear your student resume to make you a better candidate for one of those residencies.
Perfect. I have another question. Are SCNM students able to get involved in research with Dr. Burrell?
They are. I haven't been doing much research in the past 2 or 3 years since we had published those 3 papers. It was, obviously quite a daunting task to do that, and publishing research is very involved. And it just depends on when we decide to do more research. I recently just got approached by Dr. Jeff Bradstreet today. Actually, I got an email from him asking me if I was interested in doing some more research and doing some data analysis in the world of autism. And I might kind of undertake that project and see how it goes. But if not with me, there's certainly there's always a research department within this school, within SCNM, and Dr. Robert Waters conducts research all the time on really fascinating projects and has published some research projects. So really the area of research probably should be approached through Bob Waters, who's the director of the SCNM Research Institute, and through that direction, certainly, students can certainly participate and get published in research.
Awesome. Dr. Burrell, I have a question. Why did you choose pediatrics?
Well, I had mentioned a little bit before when I started that my interest in pediatrics really stemmed from my experience in working with a pediatrician up in Seattle, my third and fourth years of med school, and it was fascinating to me. I mean, you got to play and interact with children as part of your job, and you also got to help them sort of grow and thrive and get better from diseases that nobody seemed to be able to take care of. It's very rewarding because you see children who have been on antibiotics 20 or 30 times and they still get ear infections, or they have chronic abdominal pain, or they have chronic migraines, and you get them better, and they've been going to physicians for years and years, and nobody can kind of get them off of their medication, or nobody can get them to a healthy place. So I think the approach that we take as naturopathic physicians, certainly here at SCNM for children, is a very effective and safe approach, and it's just very enjoyable. It's very rewarding.
Awesome. Dr. Burrell, is raw turmeric better than dried?
The way that we usually have it because I never produce the actual turmeric that we utilize, it's almost always dried, and the reason being is that you can get a much more concentrated dose into a formula if you're using dried turmeric. And if it's raw, it's going to be a little bit more pungent. We have some compounding pharmacists that actually are able to compound a certain formula that I utilize in most of my autistic patients that seems to be very well tolerated, and that's a dried powdered form of turmeric.
Awesome. My next question, does Dr. Burrell feel there's a lot of opportunity in naturopathic pediatrics? Is there a demand within this field?
There's definitely a demand within the field of the general population. We know from the asthma research that diagnoses of asthma continue to rise despite the fact that we've come up with all these new incredible medications, conventional medications and steroids for children with asthma, but we still see the conditions increasing. And unfortunately, nobody in conventional medicine seems to understand or accept the fact that food and diet and nutrition has such a strong correlation to the health of the child. It seems logical when you present it like that, but amazingly, nobody addresses diet with children with asthma. There's an incredible demand for pediatrics and naturopathic medicine, because I think that we really hold the answer to preventative medicine and to getting to actual cures, as opposed to just sort of continuously giving medications to cover up the symptoms.
Very good. My next question, are students able to follow patients from term to term so there is continuous patient care?
like continuity of care, I think
Right.
is a very important point. You know, the program in and of itself is designed so that there's rotations through different, you rotate through different rotations. I know that sounds redundant, but that's actually what happens every quarter. And so it ends up being for 3 months at a time, you are with one physician and you are seeing their patients. So you get to see most patients for at least 3 months at a time. And if you happen to request and get on that same rotation the following quarter, then that extends to 6 months. And if you can continue to extend and request that physician, and you and the physician work well together, then you can certainly get some really great continuity of care by staying on for several quarters. And some students actually choose to do that. If they really want to do pediatrics, they keep on requesting me as one of their rotations, and then they're on my shift for several quarters at a time. And it really does take at least several quarters to start to become proficient in your history taking and your differential diagnosis capabilities and your abilities as a clinician, as a student clinician, to feel really comfortable after, in my opinion, it takes a few quarters to do that.
Very good. Next question. I'm going to take a couple more questions here. I'd like to know if there is any specialty about infectious diseases.
I don't know of any specialties in infectious disease within our profession currently. I know there are a few physicians that do quite a bit of infectious disease. Most of them, however, are not just specializing in it. I think most of the people who are doing a lot of that are either doing quite a bit of research, or they're doing just family practice, and they have accumulated over decades of being a naturopathic physician, have just accumulated a lot of experience on how to treat certain complex infectious disease cases.
Very good. Dr. Burrell, can you elaborate on the research sources that indicate that vaccines' side effects would cause autism?
Ooh, there's a huge amount of research out there, and it's not answerable in even really in an hour. I mean, it takes I think a savvy research eye, and it takes certainly a picking apart and a real deep kind of understanding of how research is conducted, as well as considering conflict of interest issues, which there's been so many arguments on both sides of the spectrum on whether or not certain research papers that have been considered the hallmark of why vaccines don't cause autism or don't cause any problems have in some cases been conducted by people who worked for vaccine companies in the past. And so there's a lot of arguments on both sides as to whether or not vaccine research that shows that it's harmful is valid, and there's a lot of criticism of the studies that show that vaccines are not harmful in any way. The validity of those papers have also been questioned. So it's difficult. I can't, it's such a long conversation, and every research paper has, I think, its pros and cons as far as why it's valid or why it's not valid. It's just such a huge topic. I think that there's some children who are just really sensitive to getting a bunch of vaccines at the same time, such as the polling case that occurred several years ago, where the polling family was awarded $1 million because they were actually able to find that the child's autism was triggered by vaccines. Now, the question is, if that child was a different child and didn't have maybe the genetic predisposition to being damaged by vaccines, would they have gotten autism? We can't really know that, but there are a few cases that certainly have made it through. as far as major cases through the courts to show that it was attached. But not every child, is certainly affected by the vaccines that they've gotten. So that's an important point to make as well.
Very good. And Dr. Burrell, this is going to be my last question for you. Is there a book that you would recommend for immunizing your child?
I think that Bob Sears did a pretty good job in writing the vaccine book. I know it's come under a lot of heat, mainly from the conventional medical aspect. I think he tends to lean more on the kind of conventional side. There's some parts of the book that I agree with and some parts that I don't agree with, but I think that gives a pretty clear explanation and description of how we got to the vaccination schedule, and I think there's another pretty clear book, certainly more on the anti-vaccination side, which I feel is not the only side to take, but there's a book by Stephanie Cave called What Your Doctor May Not Tell You About Childhood Vaccinations. And there are a few others. It's hard to find a non-biased book. Everybody vaccines is an extremely passionate issue, and I understand why, and I don't think that there's really a clear answer one way or the other in so many cases. So it can be frustrating, certainly in the world of pediatrics, to try and come up with a clear reasoning behind everything that you read about, and it's a challenge. It's probably the most challenging part of doing pediatric medicine is how to come up with a very clear vaccination schedule based on what exists out there. So
right.
We do the best that we can. We certainly consider, what is the worst case scenario, and we discuss those worst case scenarios with parents, both from worst case scenario from the effects of a vaccine and worst case scenario from, not getting a vaccine. And that's where patient education or parent education certainly comes into play and is our responsibility as healthcare providers.
Great. Thank you so much, Dr. Burrell. So what I'm going to do from here is I'm just going to briefly go over the admissions process to apply to SCNM. So here on my screen, I do have the requirements in order to apply. SCNM does use the NDCAS, which is the Naturopathic Doctor Centralized Application Service. So there is the website. So your application goes through there. With the application comes the essays and the letters of recommendation that are completed on the NDCAS website. You will need the transcripts from all colleges that you attended, as well as a 4-year bachelor's degree. The prerequisite coursework that SCNM requires are the 12 credits of biology, and all of the sciences, as you'll see, have to have a lab, and they have to be for science majors. So 12 semester credits of biology, 8 semester credits of chemistry, 4 semester credits of organic chemistry, and then of course your gen ed classes that you more than likely completed in your bachelor's degree, which is your 6 credits of humanities, 6 semester credits of psychology, and 6 semester credits of English. So those are going to be the requirements. However, I will tell you that fall 2013, if you're applying for fall 2013 and beyond, the prerequisites change a little bit. So what I would do is I would recommend that you contact SCNM and speak to your advisor so one of us can go over your requirements. Haven't changed a lot, but they have changed a little bit. So if you have any questions, I would, like I said, recommend that you get a hold of your advisor. So if you have any questions on this, the prerequisites, your advisor is going to be the best one to contact. However, it's the questions, I noticed I wasn't able to get through all the questions, so I will respond. The questions I did not answer, I will respond to you as soon as possible. In the meantime, if you have any additional questions about today's presentation or SCNM in general, please contact me at j.durham@scnm.edu. My phone number is up there, as well as our website. So at this time, I would like to inform you also that to visit our website to register for our next webinar, which is scheduled for Tuesday, June 19th, featuring Dr. Christine Gerard and Dr. Jeff Langland. The focus for this webinar will be New Frontiers for Naturopathic Research, SCNM Projects and Emerging Careers. So on behalf of SCNM, I'd like to thank each of you for attending this webinar. We hope today's presentation was informative. Again, thank you for your attendance today, and this concludes our webinar.